Hi, my name is Danielle Klinger, and I'm a graduate student at the Hebrew University of Jerusalem, and today we'll be talking about significantly improved COVID-19 outcomes in countries with higher BCG vaccination coverage, a multivariable analysis. So I'll start with some background on BCG. The BCG vaccine was developed in 1921 and is primarily used against tuberculosis with a 50% efficacy level. It is a live attenuated version of a bacteria related to the bacterium which causes tuberculosis in humans. BCG has also been repurposed and used as a successful immunotherapy for bladder cancer. Lastly, for around 20 years now, evidence has indicated that BCG recipients have long-term immune protection. COVID-19 spread across the globe with a large variance in the number of deaths per million, as can be seen in the map down below. In addition, global BCG vaccination policies differ widely. Some countries have a current BCG vaccination policies, some only a past, and some, like the United States, have never had a BCG vaccination policy at all. So this information and the fact that BCG has been found to create non-specific immune effects led us to question whether different BCG vaccination regimens in different countries are linked with improved COVID-19 outcomes. Our analysis covers 55 countries complying with predetermined thresholds on the population size and the number of deaths per million. For every country we extracted information regarding COVID-19 outcomes on a daily basis from the Worldometer website, demographic and health-related measures, information regarding BCG administration practices from the BCG World Atlas and the WHO, and pandemic restriction quantitative properties. We then normalized the country outcomes by accounting for their population size per 1 million. Then we seeked methods to align the countries according to their stage of the pandemic. The results presented in the poster follow an alignment date of 0.5 deaths per 1 million. However, the results were replicable at varying alignment dates. Lastly, we applied statistical analyses I will elaborate about. So we started off with a linear regression analysis of the number of deaths per 1 million with the number of years each country had a mandatory BCG vaccination policy. With each country represented by a dot, we observe a strong negative correlation as indicated by the R and P value. Similar results were observed using the number of cases as an outcome. So those results indicate that increased years of BCG administration may decrease the number of cases and deaths related to COVID-19. The results shown in the previous slide examining an outcome of deaths per 1 million at 20 days post-alignment can be seen here below. This is a different representation of those same results. The R is shown in the center of the circle, the p-value is indicated by the color of the circle with dark purple color indicating a higher significance level, columns represent the days post-alignment, and rows represent the outcomes. We replicated the analysis at multiple time points with all outcomes in order to test the generality of our observation. Most results show a highly significant association, as we can see by the dark purple color in most circles, meaning that BCG vaccination is associated with reduced deaths and cases of COVID-19. So next, because countries differ in many quantitative measurements, we wanted to examine if when we add additional covariates, the results stay significant. So we applied a multivariable analysis for an outcome of deaths per 1 million at 20 days post-analysis and included 23 variables that can be seen on the y-axis. As we can see with the BCG administration years variable that is colored in red, it has a negative beta coefficient with low variance and is found significant as indicated by the numerical value above it. In fact, out of all of the variables, the number of BCG administration years has the most significant signal. We next investigated the relevance of age groups to the observation. Here we can see the correlation between the share of the young age group vaccinated with BCG and the total population deaths per 1 million. We see a highly significant result indicating that a vaccination coverage of the younger population results in less deaths in the total population. So if we look at the middle age group, we can see a similar trend, though with weaker significance. And remarkably, for the old age group, the correlation is negligible and insignificant. So it seems like most of the signal comes from the immunization of the younger age group. We followed up with a generalized version of the previous analysis done by age group for all outcomes at different time points. So the y-axis is a minus log 10 of the p-value, and the red dashed line indicates a 0.05 p-value, and any bar passing the red dashed line indicates a significant result. So this really shows the dominant contribution of the young age group to the negative correlation at most time points in all outcomes. We then investigated whether other globally used vaccines may have a similar effect on COVID-19 outcomes. So the efficacy of BCG against tuberculosis is expected to span approximately 15 years. We thus divided the countries into 3 groups representing the varying vaccination policies over the last 15 years. Countries with full vaccination policies, below median vaccination policies, and no vaccination policies. So the results were found to be highly significant, as can be seen here below. Following that, we examined the rubella and measles vaccines. We divided the countries into 2 groups for each vaccine, above and below median vaccination coverage over the past 15 years. The results proved insignificant at all tested dates. So to summarize up my presentation, we found a strong and unique correlation of BCG and improved COVID-19 outcomes that was sustained at a range of time points. The multivariable analysis conducted validated the importance and statistical significance of BCG immunization years given all other variables. The strongest correlation is attributed to the coverage in BCG vaccination of the young population, and this really fits with the fact that BCG vaccination is effective for around 20 years. In addition, we provide an interactive website that updates daily and allows users to change parameters along with the pandemic progression, and we welcome you to try and use it out. And with that, I will end my presentation. Thank you very much for listening.